Some experts say models show this week California might hit the peak in terms of hospitalizations and treatment of COVID-19 patients. As the coronavirus crisis continues, the question is, how are local hospitals ramping up?
Chief Medical Officer with Dignity Health, Southern California, Dr. Nicholas Testa is joining us now. Good morning and thank you for joining us. This weekend, we saw lots of people hitting the beach. How dangerous is this?
It's a problem. So right now it's getting hot, the weather's getting nice, and people are getting lulled into this sense of safety. But remember, the cases are still going up in Los Angeles County. So we really right now need to stay in this predicament of social distancing for just a little bit longer, because letting up right now is going to really result in a second wave that is going to cost more lives.
Small business owners are fighting for their business life. Salons, barbers, some are saying they're going to open for business despite stay-at-home order. What do you tell them?
Yeah, that's hard. That's very hard. And what I tell them is the same thing I tell my kids and my friends, which is we need to stick this out a little bit longer. And I need to extend a thank you to them and everybody who's sacrificing for the physicians and the nurses and the paramedics and everyone else who's out there who you're doing this also for, because it makes their jobs doable. So we're going to need to reopen in a very calculated way. And I hope that the first thing we start focusing on are some of those small businesses that we all need. All of our hair is getting longer and grayer, and we need those salons to open back up, but we need to do it in a calculated way. But I'll come back to your first question, Giovanna. We can't start going back to the beaches and doing that. That's imposing risk that is unnecessary.
Okay. Now, some drug companies are ramping up to produce vaccines. What factors go into an effort like that to develop a vaccine?
Yeah, so there's some interesting stuff, right? So the Oxford Vaccine Group released their first preliminary information that they have a study in 6 monkeys where they were able to prevent the coronavirus, which is great. But that's just a very small first step. For us to actually have a true vaccine, there's a whole myriad of phases. But the 2 big phases is the phase 1, which is actually safety. We have to make sure that the vaccine is safe for the general population, right? This is something we could be giving to every single person on the face of the earth. And then the second thing we make sure is the efficacy. So if we're going to give it to everybody, will it actually benefit everyone? So I just caution, it's great that we have 6 monkeys who we prevented coronavirus in, but 6 monkeys to the whole world is a big leap, and there's a lot of work to do. So I'm going to come back to Dr. Fauci's comment that it's going to take us a good year to 16 months to get there. And remember, with the Ebola virus, it took 5 years to get a vaccine for Ebola virus, and even at the beginning, they were able to implement an animal model years before it got to a human model. So let's stay cautiously optimistic.
Okay, all right. Once again, thank you, Dr. Nicholas Testa, for joining us today.